Hi, I'm Dr. Louis Esquivel, and if you're interested in alternative and holistic means of healing, then I'd like to help you. My training is in family medicine. I'm board certified in family medicine, but I've been interested and I've been practicing holistic styles of medicine for over 20 years now. I utilize the full breadth of my training, which includes conventional medicine, diagnostics, and therapeutics when necessary, but I always try to use holistic and natural means of helping people through their medical problems as much as possible. That is my prime focus. So I'm a little bit different from the average physician in a few respects. Obviously, practicing alternative medicine is the obvious distinction. But I think even within that realm, I think the difference is that I have, or at least my approach is, I think, a lot broader in the sense that I still use and investigate conventional medical ideas and diagnostics and therapeutics as well as considering alternative ones and trying to find that balance for the patient. It ultimately comes down to what is the diagnosis that the patient has, what is their problem, what is a safe and reasonable treatment protocol for them, and to be able to do that right, the way I think is it takes time. So another area where I'm quite different is my intake evaluations are actually fairly extensive. I spend at least an hour to an hour and a half with my patients when I see them, particularly the first time. I make use of very extensive questionnaires along with just the interview itself, complete physical examination. I make use of diagnostics, whether that's blood studies or radiological studies if needed. So I think if somebody is contemplating seeing someone like myself, an honest question would be why? Why as compared to continuing in just seeing their present medical provider? And I always tell people certainly that is their choice. What I try to bring to the table in terms of my skills is looking outside the box. Most of the patients I see have already seen multiple physicians, they've had multiple interventions. Maybe they're people who are just naturally inclined or interested in natural and holistic therapies. Maybe these are people who are at the end of their rope, so to speak. Maybe they have a very clear-cut problem, but the interventions that have been offered either are not quite helping completely, or perhaps because of side effects, it's a hard road to continue on. That is not to say that I necessarily have magic or anything that is extraordinary, but what I do offer is my full intent and desire to try to find reasonable solutions for them within the alternative world of medicine, and with the first and foremost desire being to make sure that we have a clear diagnosis, we have a reasonable treatment plan that's not going to be harmful to them. If anything, a treatment plan that will enhance their general state of health along with helping whatever problem we're dealing with. So if a person is interested in that, then certainly that's the type of patient I try to help, and encourage that they do come in for treatment. A common question I often get is what kind of patients do you see? What kind of problems do you take care of? Well, I can say I see patients really from the whole spectrum of age groups and even diagnostic categories. So I see children, I see middle-aged people, I see geriatric people, I see men and women for a variety of problems. Some of the more common problems I see, particularly in the adult population, would be areas related to fatigue, hormonal imbalance, thyroid problems, gastrointestinal problems. In terms of childhood conditions, the most common condition I see are related either to behavior or autism spectrum disorder and conditions of the like. A wide variety of therapeutic interventions are available to me. I like to think that I have just a bigger toolbox in terms of what I can use to try to help people, whether it's looking at conventional lab data or looking at more, or rather less common diagnostic studies like nutrient analysis, heavy metal analysis. Very common study I often get is adrenal stress indexes or gastrointestinal testing. The methods of treatment span everywhere from dietary change, which actually is a very big component of what I recommend, but also specific supplementation based on particular needs, generally determined by testing, and a number of other interventions that span whether the nutritional arena or perhaps even energy medicine arena, and even involving mind-body techniques or so-called energy psychology techniques to help people with mood and psycho-emotional issues. I really treat a quite wide variety of clinical conditions, but one could actually summarize or crystallize those down to a handful. I see a lot of adults with fatigue-related problems or hormonal imbalance-related problems, whether that's with menopausal issues, perimenopausal issues, thyroid conditions, certainly both in men and women. I often see many problems related to dietary problems, really, in terms of either allergy related to either intolerance or classical allergy to certain foods, which is actually very common, and which many times goes relatively unnoticed. So that's a big area that I see. I see children primarily with issues related to behavior, whether that's attention deficit, maybe a child on the autism scale. Children with allergies or other conditions of that nature are quite common for me to see as well. I always like to help people understand that much like a traditional family practitioner, I tend to see a fairly wide type of cases, and if there's ever any question as to whether a person's particular case can be helped or not, I always encourage them to call or in particular email me, and I will return my response to them regarding that freely. When a patient first comes to see me, we need to have a fairly extensive intake evaluation. So it takes, I think at the minimum, at least an hour, if not an hour and a half, to cover the full history of the patient. So I make use of extensive questionnaires in addition to just to the face-to-face history taking in terms of trying to understand the full story of this patient and in particular what their primary issue is. Utilizing the holistic model of health, it's critical to get that big picture. It's not sufficient just to know what your, as we call, chief complaint or the main problem that's concerning you at that given time in your life. From a holistic point of view, we see that as only one aspect of a greater picture, perhaps of a greater level of dysfunction that really needs to be fully developed. Much like a portrait, you know, the whole story needs to be understood as a whole. And so for that reason, it really takes a lot of time to understand that. So again, that sets my practice apart from an average practice, which unfortunately, because of a lot of reasons, is quite limited in how much time they can give the patient to fully explain and develop their symptom picture. So why do I do what I do? That's a good question. I came into medicine, I think, with the fairly altruistic motivations of really wanting to help people. And through the process of training, unfortunately, felt that to some degree I really wasn't doing that. And there was a stage in my life when I began questioning that. And during that process, literally, quite randomly, I think, stumbled into a form of holistic medicine called classical homeopathy. That experience really opened up a new way of thinking about patients and medical problems, because it turned out that the very subjective, if you will, nature of illness becomes quite critical, particularly within the homeopathic framework of thought. And whereas in conventional medicine, that information really doesn't fit in terms of our diagnostic ways of categorizing and then therefore helping people. So it really turned patient evaluation and the approach to illness and disease really on its head for me. And that's really where it all started for me. So I began studying more and obviously still practicing conventional medicine concurrent to that. And over the course of time began seeing the unique power, if you will, of many, not just classical homeopathy, but many other natural-based therapies, such that now I incorporate nutritional therapies actually quite heavily. I still utilize classical homeopathy. I utilize a number of other techniques that I've learned along the way. And that essentially has revitalized my initial reasonings for getting into medicine to begin with. Truly wanting to help people get through their problems. And I have to say that also too, just from an intellectual point of view, I enjoy the challenge. And so this form of medicine has been very satisfying to me, both in terms of feeding my intellectual needs, but then actually my deeper desires to be helpful, which I think is just really a part of human nature, really in all of us. I think we just all have our own ways of expressing that, and that's my way.